29th, and thank you once again for joining us. We have quite an agenda today, just a little bit of catch-up and follow-up. Oh, and, of course, my cell phone's ringing, so I apologize for that. To start with, commissions, many of you are calling and asking about commissions, and I know it's been frustrating for everyone that has been working so hard and has seen not one dime yet. But I did want to let you know that commissions are trickling in. I know I say this, and I have said it before, but we just got a large data feed from Geisinger, and it appears that all of the 1-1s are starting to pay. So I encourage you to check your commission statements closely. Let us know if you have any missing cases, and we'll track them down for you. Brandy Coleman, of course, is our Director of Commissions here at URL. She can be reached at brandyc@urlinsgroup.com or by calling our number, and she's at extension 143. So again, I encourage you to reach out to her if you have any questions on commissions, because more than anything, you deserve to be paid for all of this craziness that we've gone through. Next on our agenda is the PCORI fees, and just a reminder that the PCORI fees, which are the Patient Centers Outcome Research Institute fees, need to be filed by July 31st. It's an annual fee. And if you have a client on a fully insured group, the insurance carrier pays that fee on behalf of the group. If your client is a group that is self-funded or has an HRA, that needs to be paid by the administrator, which is the employer for the group. So again, self-funding groups, it's $2 per covered life. And if they also have an HRA in place, then it's an additional $2 per covered life. So just be aware of that. There's information in my newsletter that's going to be going out tomorrow about the PCORI fees. We still have some time, but there is a tax form, Form 720, that needs to be filed. And again, this is just another way, in my opinion, to reach out to group clients and just introduce yourself, become the resource that they need. Because again, I believe that small groups and groups in general at this point are where your next opportunity will lie. There's the COBRA extension that the FSM has given. So by reaching out to these groups and talking to them about the PCORI fees or even the ERISA documents that are required, you can find out who's on COBRA and get them onto the FSM. So there's a lot of opportunity, in my opinion. So again, reach out to those groups that you have as a client, or start knocking on businesses' doors and introducing yourself and getting new clients. Next item on our agenda is regarding the tax records on the FSM. When you've made application for your clients on the FSM, and I'm guilty of this as well, there was a box that you could choose how long the FSM could grab your tax records and compare them and use them to determine subsidies. Now, being the cynic that I am, I went in and I basically said, 1 year, that's it. What I've come to find out just actually late last week is for those that have put in 5 years or something other than a year, then the tax records are going to be pooled, and from what I'm understanding now, there's not really going to be a need for your client to sign back in and update their income information. For those of us that put in 1 year, then upon renewal or the opening of the enrollment period for 15, which is 11/15 of 2014, your client will have to go back in and update their income. So it's going to be an extra step. It's going to be, as always, a pain in the butt. But, that's just FYI for moving forward for this year. If you've already put in 5 years, then you're good. If you want to contact your clients and go back in and make changes now to those tax records to allow them for longer than 1 year, then I encourage you to do that as well. So that's the information that I have at this point. Many of you, and just to back up a little bit, I'm sure we'll get more information as we get closer to the end of summer, and certainly, hopefully, by 11/15, the opening of the next enrollment period. For those of you that utilize our quoting portal and or the consumer upgrade with eBix, I do have an update on our web broker contract. I did have a conference call with our support team at eBix last night, and they had a conference call earlier this week with CMS. All the web brokers had a conference call. And what they said during that conference call is that well, first of all, there's only one approved web broker at this point, and it's the Go Health chassis. And how they got through, I don't know. But they're the only ones that have gone through all of the testing with CMS. Even Go Health will not have the functionality outside of open enrollment to have a direct connection to the FFM from their web broker system. So what that basically means is we are now in a holding pattern, getting things coordinated until, get this, until November 15th of 2014. CMS has decided that they're doing all of these updates, but they're not going to launch any update until 11/15, which of course brings us right into the first day of election or open election period for 1/1/15. Yeah, great timing as normal, but that means that our web broker contract, there's nothing that's going to happen until November, unfortunately. We're not alone in this. Every web broker out there is in the same boat. It's not the news that I wanted to hear, but it's at least news at this point. If something changes, obviously I will let you know, but at this point, that's where we stand. I am looking into another system, but I don't have much hope that it's going to be any different. So, again, if the web brokers are all in this mix together, so not great news for any of us. We still continue to hear issues on FFM reporting from the federally facilitated marketplace to the carriers. For instance, if there's an update, if they're adding a spouse, a new spouse, or adding a child, or changing income, which therefore changes subsidies. There's information, bogus information, that is being sent from the FFM to the insurance carriers. So, as I mentioned in some of my previous webinars, if you have somebody that is making a change, document that change. Let us know about it. Just shoot your case manager a quick email about it. But I do think that you really need to start documenting that change and when you went in to make that change with your client, because otherwise it's just going to be another mess of trying to remember what the change was and what the effective date of that change was. So again, just keep good records. Speaking of keeping good records, we are implementing a new notification for FFM enrollment, and that's going to be coming out in the next couple of weeks. For those of you that are enrolling new clients because of qualifying events onto the FFM, we're going to have something similar to what we do on the Medicare Advantage side in notifying us of these clients so we can be more proactive as opposed to being reactive and trying to hunt down these cases. I think it's going to make the system moving forward and definitely into the 2015 enrollment period much easier on all of us, and we're going to be able to hopefully track down any commission issues or issue issues, effective date issues, more quickly than we are now. The next item is the SEP form. Pardon me. We all know that most carriers have special election forms, and I encourage you to use those. Obviously, that's a requirement for off exchange. But also, you know, the carriers are not, they can randomly audit these special elections, and I'm not saying to be fraudulent, but if you feel that your client, and definitely hear me again, I'm not saying to be fraudulent, but if you feel that your clients can fit into any of these categories because they're very broad and very gray, then give it a whirl. You know, try to get them in if you can, if you feel honestly that they can fall within these categories for a qualifying event. And don't forget, again, about the people on COBRA. They have an extended enrollment period up until 7/1 of this year to go on to the FFM, whether they need a subsidy or not, and make application. They can voluntarily terminate their COBRA and take an FFM plan with or without subsidies. I didn't have any submitted questions this week again, but it looks like we do have some from the open forum. As a reminder, next Thursday, June 5th already, can't believe it's June, we will have our weekly webinar, as always, at 9:30, so join us if you can. If not, then you can certainly, you know, log in to our website. Actually, I don't have any questions at all that were even typed in. Oh, here's one. Jamie says, can you clarify a point about the COBRA enrollment window? Does this apply to only on marketplace as opposed to off marketplace? No, it applies for anybody that is on COBRA currently, whether they are subsidy eligible or not. The caveat is that in order to claim this extended enrollment period, you have to call the FFM, you have to make application through the FFM, even if they're not subsidy eligible. That's the only way to claim this extended enrollment period. So if you have somebody on COBRA that missed the election period and they, you know, their COBRA is not even expiring until next year sometime, you can actually talk to those people, look at what they may qualify for or get, even if they're not subsidized, on the exchange, and they again can voluntarily terminate their COBRA and make application through the exchange. So hopefully that clarifies it. So it looks like we have a pretty quiet crowd today. No other questions. I did have one question from one of my agent partners. She had a situation with one of her clients, and she does have her hand raised. So I'm going. Oh, looks like she unraised her hand. So I was going to unmute her. Lori, if you still want to do that. Yep. Okay. All right. I'm going to unmute Lori, and she's going to ask the question. She has a situation, and she's just looking for some guidance. And, you know, that's one of the things that I wanted to hopefully get out of these webinars is we learn from each other. So let me see. Lori, can you hear us?
Yes. Can you hear me?
I absolutely can.
Oh, great.
Want to go ahead and talk about your unique situation?
Yeah. I have a client who has 3 children. The ages are 21, 14, and 10. And she is a widow. Her husband was killed actually in a car accident. It's a very sad situation. The 21-year-old is on Medicare and is disabled due to disability. And the 2 children are on CHIP. All 4 of them receive Social Security death benefits. And the mother receives dividends from a Morgan Stanley account. So all total, their income is approximately rounding around $70,000. But the mother alone, if I take into account just her income, would be just under $30,000, which would be the Social Security and the dividends from Morgan Stanley. on her tax return, I'm assuming that the Social Security is not taxable because it's her line 45 shows approximately $15,000, which is the dividends from the Morgan Stanley. When I put this in the Kaiser Foundation calculator, and we did go through and called the marketplace to apply, she does not qualify, even though she falls within the tax credit guidelines. And although if I take just her income, which would be around the $29,000, she should receive around $177 a month. So Deb and I have discussed this, and it looks as though she's falling into some kind of a gray area. And at this point, she doesn't qualify for any subsidies. And I just was wondering if anybody has had any other circumstances similar to this, and if there's another way around this. I could have her not take the dividends, but then I don't know that that would change anything as far as her income, since it's not taxable through Social Security. So I just was looking for any kind of feedback. I don't really want to appeal it because that's I don't think that that's really going to help.
Yeah. All right. Does anyone, what Lori and I muted you, Lori, so we wouldn't get feedback, but just let me know if you have anything else to add. But what Lori and I did yesterday was we kind of looked at, and Tracy says, when she enters the client, does she claim the 3 kids on the form as a tax credit? And yes, I believe that's correct. Lori, correct? She does claim all 3 kids.
Yeah, we try. Yeah, they have to put on there because they're part of the household.
Yeah. And what we played around with the system, and what it looks to me that it's doing is it's taking into account her FPL percentage and then the percentage of premium that she's allowed to pay. And because she's the only one that's applying, the premium that is being shown is actually less than the percentage due to her FPL percentage that she's allowed to pay, the maximum. So I'm thinking it's just one of those situations where, I mean, her income is her income, but I know Lori was looking at maybe reinvesting and bringing her income down a little bit lower, which seemed to have helped. But I guess it's just an odd situation, and we're kind of looking for, has anybody else experienced this, and is there a workaround on the FFM, or is it what it is? It is what it is. Tracy said call her when we're done with the call. So what I'll do, Tracy, is I will, with your permission, give Lori your number, and maybe you can talk with her a little. Dana says that she's had 2 clients with similar situation. One received subsidy, one did not. It came down to the one who did receive the subsidy. Her income was less than the individual threshold, and the one who did not receive a subsidy was because the household income was higher than the individual threshold. So, yeah, I mean, it's crazy. That's all I can say. Sometimes it works and sometimes it doesn't, but unfortunately it just seems that this lady is kind of caught in the midst of, what she can qualify for, and, because, of course, bringing her income down lower may actually throw her in that donut hole that, she makes too little to qualify and makes too much to qualify for Medicaid. Dana says, it's inconsistent, as you can see. Yes, yes, that's definitely the word. Well, Lori, what I'll do is I'll reach out to you after the webinar, and I will get you in touch with Tracy. Tracy has done hundreds of cases on the FFM, so she's a good resource, definitely, and she might be able to offer additional advice. So with that being said, I don't know if there are any other questions. I'll give it a few seconds to see if any others come in. Again, just a reminder about next Thursday. If you've missed any of the webinars or if you can't make the webinars, you know, they are always on our homepage. You can view them. Just go to our homepage, which I can't show you right now. Go to our homepage, and on the right-hand side, you will see a YouTube icon, and you can click on that and see all of the PPACA webinars and also all of Steve Clemens' Life webinars, Joe Corio's Annuities, Christie's Limited Medical Plan. So there's a lot of information on that. So I encourage you to go there and pop some corn and listen to the webinars. Again, I thank you for participating and wish all of you a wonderful rest of the week and a wonderful weekend. Have a great day. Bye-bye.